Caring for Kids God's Way, a biblical counseling certificate program in child advocacy developed by the American Association of Christian Counselors through Light University. Your ministry is to be a Galatians 6:2 helper. Ours is to equip you with the highest level of advanced training from the world's leading Christian counselors. 24 experts teaming up to create the most comprehensive child studies curriculum for the personal classroom. May the Lord bless your study as you begin caring for kids God's way. Caring for Kids God's Way presents attorney at law, clinical social worker, and Christian Counseling Today's senior editor George Oschlager with child counseling expert Dr. Mark Shadone, legal and ethical issues in children's work.
Hello, this is George Oschlager. Thank you for joining us in our continuing series on Caring for Kids God's Way. I'm joined today by my friend and colleague Mark Shadone, Dr. Mark Shadone as he's just received his doctorate in counseling. I want to congratulate him for that. Mark is with us to discuss legal and ethical issues and the counseling implications of working with children and adolescents. I want to start by talking about training and boundary issues with young people. In fact, we're going to talk about essentially three things here today. Even though most issues in work with children have some kind of legal implication, the big three issues that most people deal with in work with children are boundary issues, confidentiality and consent issues, and child abuse and abuse reporting. So Mark's going to join me today in discussion of these three things. And I'd like to start out by talking about training issues and boundary issues. Mark, as a practicing clinician, as I am, what kind of things do you think people should be trained in, if anything, regarding work with children?
I think one of the main areas is to know about the development, the developmental stages. I think Dr. Amen is doing a series on the brain development.
Yes.
In the past few years, we have learned tremendous amount about the brain, and a lot of things that we thought about it, were not accurate. It's still developing. And although I think we understand the developmental stages of kids pretty well, it's really important to know those stages.
Yes.
Because that can really determine how you teach a child, how you relate to a child, and also an understanding if they're not at that level, why? Is there some problem that a child is, say, 15 and developmentally a stage or two behind?
Yes.
So I think those are things that a person can study. Obviously, probably through just reading some good books.
Yes.
On development. But it's an interesting area too, and I think it's one that we don't emphasize as much about. That would be one of the most important. I think the other area, because of the fact that these problems exist, but I think people who are working with kids, lay people or professionals, or folks who are supervising those kind of
Yes, good.
need to have an idea of what are signs of some problems that unfortunately exist in most churches, just like in the rest of society. Mm-hmm. Things such as child abuse, sexual abuse, alcohol abuse,
Yes.
not only of children and adolescents, but even parents.
Yes.
To know about divorce and how that affects a kid.
Yes,
To have an idea about some of the problems kids have, so that when you're with them and you see those signs, because we're talking frontline people here.
Yes.
They're going to see these folks before a counselor does.
Yes. Those of you who work in church settings especially are going to be the ones who notice, if you are trained to notice, those signs that indicate problem issues in the child's life, in the family system, possibly in the church or even school community. For instance, bullying in schools is becoming a very significant issue that we find more and more families dealing with, children dealing with. The stresses, the anxiety, those kinds of issues are seen, as Mark has stated, first by those frontline workers, youth workers, Sunday school teachers, pastors, far before a counselor comes to any kind of introduction with these issues. So training in these and recognition of these is very important.
And I would add to that, I've worked with kids most of my career. I worked in the school systems as an intern in my social work program. I've been in private practice and worked with Christians for almost 25 years. So that's the kinds of things we're talking about are the kinds of things I've always worked with.
Yes.
And the need, I think, for frontline people also to have some idea of what does a depressed kid look like? What's an over-anxious kid look like? And one biggie, because I specialize with attention deficit, but these kids, when they're in Sunday school or they're in different activities, a lot of times they're the ones that are bringing some of those problems that they have at home or in the classroom. Man, they're bringing it right into the Sunday school, and they're ostracized, and they're misunderstood. So I think that that is a child who might find some solace and sanctuary in his church, but what ends up happening is the same kinds of problems and reactions occur there.
Yes.
And so he doesn't even have that safety. Sunday school teachers or people, youth workers, I think need to have some idea of what is attention deficit, what is a depressed kid, what are those symptoms. Not that they have to become diagnosticians, but they need to know, okay, what's different from normal child behavior.
Yes, good.
Those are, I think, crucial things.
Yeah.
Again, they're going to see these folks before we do.
And we have had videos in this series that discuss and review the various symptoms and behavioral markers that indicate a wide variety of issues that you want to flag and address with parents and with school and other authorities. You mentioned frontline workers, and we know, sadly, tragically, that pedophiles are very attracted to these positions, knowing that that is a key way to get direct access to children. So one of the things that churches and parachurch ministries, any organization working with youth must do is protect against pedophiles entering their care system, their work system, their volunteer system. And it's a first-class challenge in our world today, as a lot of pedophiles are very slick in how they present themselves and present their backgrounds. And finding ways to protect our children by screening out those who want to get access in order to abuse our children is critically important. And my guess is a lot of people are hearing you say that, what would flash through their mind is, well, that wouldn't happen in my church or in my Sunday school. Again, in 25 years of practice, it's been entirely with Christians and Christian churches. It does happen. It happens in some of what we would consider the most accountable churches. Yes.
And I think the reason it happens is because people, A, don't believe it will happen in their church or in their family or to their kids. And then the other side of it is, pedophiles are slick. They don't look any different than anybody else. And typically, they have the kind of social skills that enable them to be getting in positions of accountability with kids and in contact with kids. And typically, youth workers are not always in a team. A lot of times they're working solo.
Yes.
And so they have sort of some built-in ability to get away with things.
Yes.
two cases come to mind, if I can, no names or anything.
Sure, sure.
But one of the first situations I remember was a very big church, had a wonderful ministerial staff, very on top of the counseling issues. And one of the men who was helping out with the preschool nursery at church was a pedophile. Now, he was there helping his wife, and he was abusing young kids. It came to my notice because the child was referred to me and was acting in a very strange way that it had not been acting before. And we were able to, sort this out. Another situation, which was a Christian daycare, kind of a small setting, run out of a woman's home. And her son, who was 14, was a developing pedophile. And a lot of what we have to be aware of too is that pedophiles tend to start early. They start this kind of behavior maybe even in their elementary school years, develop and refine their skills as a teenager. But this young man was molesting some of the kids when they were asleep. He would sneak in there. Now, as it turns out, he had been molested by an adult.
Sure.
And so what you have is this ripple effect.
Yes.
But this kind of problem can come in any number of ways.
Yeah.
And again, I think if you know what to look for, if behaviors change in a child that you're working with, it'd be nice to prevent it. But a lot of times it may not get prevented. We need to be able to intervene and know what we're looking at.
Absolutely. Yeah, I recall a case I consulted on through AACC last year where a church had hired a new pastor, and the adopted 15-year-old son of this pastor essentially had free reign church property and roamed the church during church services and so forth. And this 15-year-old boy who had been molested himself turned out to be a molester of younger children. And it was a very difficult situation for this church to confront, for the pastor and his family to confront. It eventually led to the pastor leaving the church and essentially denying that the adopted child had engaged in such behaviors. But we see an increasing trend even with teenage boys and young men in their late teens and early 20s who begin this molesting activity and behavior very early on. So it's very important to be careful, be on guard. Doing background checks is critically important with anyone you bring on staff. And if they don't give a list of references, and you should ask for references, and you should ask and be sure that you get consent from these people to talk to references very openly about their backgrounds and about whether there has been any problems in the past regarding sexual misconduct behavior. Very important to do this kind of work in protecting our children in churches today, sad though it is.
And I would say, just based on my experience, that I wouldn't take anybody for granted. I wouldn't take me for granted. I think that there are counselors who have abused kids. There are obviously pastors and youth workers who have.
Yes.
And the thing that people need to understand is folks who abuse kids are good at getting access to kids, and they're good at getting access to kids in ways that are not going to send up any alarms. The other thing probably, and it's I think hard for all of us to believe too, but how often do you turn the news on and you find out about a female teacher who's having a relationship with a student?
Yes.
And what I think we're going to unfortunately discover is that there probably has been as much or a lot more than we ever would have thought female abuse by mothers, sisters, female babysitters, female teachers. We don't think and want to think of our sisters or mothers or females in that role, but that's how this problem develops, is we don't think about it. And that gives free rein a lot of times for these people to act on these things.
Yes, good point, Mark.
You know, I think we're beginning to see that is a problem, and I don't think it's a new one.
Not at all. And to confront the double standard that exists in our society between someone, I remember watching Geraldo and him kind of smirking at the thought of being abused by a very attractive young teacher. You know, where were these teachers when I was in school? He would kind of half smirk, and reflecting this double standard in society where a man certainly has no permission to abuse, but do we give females in our society tacit permission by the way we communicate to them? Boy, you are very sexy, and, you know, like Geraldo said, where were you when I was a student? That can't go on in our churches or in our ministries. We've got to be as clear about our boundaries with women as we are with men.
Absolutely, because it's about you know, the boundary issue here is that we're trusting not only the child or the teenager, but as a parent, as pastors, as counselors, you know, we're trusting that there's some sanctuary here.
Yes.
When we send a child to anything, you know, church or Christian related.
Yes.
And if that is violated, as I'm sure some of the series talks about, you know, what does it do to the child's level of trust with adults? It's you know, one of the cores of a kid's personality, and all of us, is who we are sexually.
Yes.
Our masculinity, our femininity, our understanding of sexual behavior. And there is nothing probably more confounding, maybe even psychologically debilitating, than an adult or a trusted, you know, person in the church. It might be a teenage camp counselor at a Christian camp.
Yes.
Who completely skews, you know, a kid's identity as who God made them, as sexual people.
Yes.
And we see it 10, 20, 30 years later sometimes.
Well, we
Someone
sure
will come
do.
to the office and say, you know, when I was at camp as a 12-year-old,
Yes.
something happened to me. And the reason it was never talked about is because, again, this person that abused them was hooked into the authority. They were respected. They weren't. It wasn't imaginable that they would do something
Yes.
like this.
Yeah, absolutely.
And so kids are gonna say, you know, I'm not, you know, I'm just some kid. Nobody's gonna believe me. And you know, and way into their adulthood, they finally reach a point where they need to talk about it.
Yes.
So we need to screen this because that stuff doesn't
Very
have to be
much
carried
so.
around by people for decades.
You make a good point about talking about it, and I'd like to speak for a moment to you supervisors, as legally, as a supervisor, you are as responsible for the misconduct of anyone under your supervision as that person is themselves. And one of the things that was so affirming, so protective, so powerful for me doing Christian therapy for the years that I did it was an agreement that I had with my partner in California to talk very openly and freely about our attractions to sexually attractive women, and what kinds of situations we might get into that seductive behavior might be going on. Supervisors need to normalize these kinds of discussions with your supervisees. If you're a pastor with a young youth pastor working with teenage girls, for example, you need to be able to create an environment that allows very open discussion about attractions, seductions, feelings of sexual attraction that youth workers are going to have toward their young female charges. This is very important that you open up this arena and allow for very honest discussions about this. One of the things that's critical is that any kind of light shown on this otherwise secretive behavior or this otherwise shameful behavior that someone may be constrained from bringing to a supervisor is simply to have the supervisor, you as a pastor, you as a clinical director in an agency or a clinic, to invite discussion of these things yourself and let them know that you yourself have had these struggles in your history coming up through the ranks, if you will. Maybe even your current history, these struggles still go on from time to time. But creating an environment where these things are discussed, openly talked about, boundaries established, accountability established, being able to freely discuss them with someone whom you know is not going to be a punishing force, is not going to be someone who is going to bash you for disclosing these very real and common feelings, critically important in your supervisory work in whatever capacity that is.
And I'd say, as you were talking, I was thinking of some of the different situations I've known about or worked with over the years too. And the other end of it is particularly more for maybe the 13 and up age level. Mm-hmm. But a vulnerable girl or boy may develop their own attraction for the opposite sex youth pastor.
Yes.
And may even have some homosexual feelings for the same-sex one.
Yes.
Again, the idea that this doesn't happen in churches, we've really got to get away from. It does. And at a young adolescent age, sometimes kids are really trying to understand their sexual orientation, their sexual feelings.
Yes.
And we have a society now that is sending out a lot of confused messages.
Yes.
That in some ways even tries to affirm feelings of homosexuality, that's how God made you or that's who you are. But if the youth worker, particularly with the adolescents, is just trying to handle that problem on their own, that's a mistake. Mm-hmm. They need to, this is my feeling, they need to have weekly meetings just like any counselor would have.
Yes.
On a staff, where they're talking about what's going on and where a colleague or a supervisor is asking them questions, and that there's a forum at least where if these kinds of things are noticed, it can be talked about and not kept in isolation.
Yes, good.
That's my fear with anybody working with kids is so often they're working by themselves, and they're younger, so they're not seen as maybe a full equal to the associate pastor or the pastor or
Yes.
some of these other folks, and they may be kind of interns learning how to pastor. They're doing a college internship or something like this. Mm-hmm. They may not be seen as someone who's going to be on the staff for a while. So we don't take the same measures that we would with someone who is a full-time employee. I think we need to really do that.
Yes. Well, you make a very good point that helps us segue into a discussion of confidentiality and consent. The law considers a child, someone under age 18, as not able, due to the lack of adult standing, to give consent on their own. So consent lies in the parents' hands regarding the major issues that affect the child's life: their health, their welfare, their financial standing, Whether or not they can engage in counseling or not is a decision ultimately that parents make for their minor children. This creates a lot of issues in counseling, especially with adolescents who are near the age of majority, who are close to 18. Most states, for example, allow a child to give consent at age 16 or 17 as if they were an adult. In a number of states, even children as young as age 13 or 14 can give what may be known as partial consent for emergency situations, such as a pregnancy, such as discovering that they may have a sexually transmitted disease, some kind of abuse situation or criminal situation in which they were involved in. They can come in under this emergency situation and meet with the counselor for 1 or 2, sometimes 3 sessions without contacting parents or before a counselor or a pastor needs to bring the parents in. Many times a child will not, in an emergency situation, want to disclose what they are experiencing with the parent. And it's very important for the counselor to disclose to that child that the parent must be brought into the conversation at some point. Maybe this session is something that can be held in confidence, but tomorrow, would you bring your parent in? You might ask as a counselor. When we meet again about this situation, how are we going to disclose this to your parents? And what do you think your parents' reaction is going to be? These are common questions that counselors need to ask in this whole process of gaining consent to continue in counseling work in the interventions that you want to engage in with the child you're working with.
And these are murky waters.
They are murky, aren't they, Mark?
They are.
Yes.
You know, and most of my thinking on it is, you know, from a professional therapist who also has not only the legal requirements, but also the ethical requirements of the board that licenses me.
Yes.
But then also as a Christian counselor, certain moral and biblical principles that come into the mix as well. You know, and I would say there's no easy answers on this when it gets in a gray area. For example, if you're working with an adolescent who reveals that they're having sex with their girlfriend or boyfriend, or they're drinking, or they're using marijuana, or you know, any number of problems that we know parents would hopefully be concerned about and want to take some kind of action on. That's one of these fine lines. If you share that information, do you lose the relationship, the rapport, and the trust with the adolescent who shuts down? And you may be the only
Big question.
You may be the only connector with that kid who can talk to them.
Yes.
So do you endanger that by informing the parents? And that's a tough one. And
That's
it
a
may
real tough
and
one.
it may be it may almost be a case by case situation. There's certain principles I tend to work by when I and I think this would go for lay counselors, pastors, youth workers, or professionals.
Yes.
When you're working with a kid, you're not a pipeline to the parent because they
Absolutely
will
not.
not tell you anything, and the parents need to understand that.
Yes.
And the kid needs to understand that. But I'll set some guidelines such as, you know, if there's something really that you don't want me to tell your parents that you're doing that you know is wrong, you probably shouldn't tell me. Because I may feel, you know, as a Christian counselor, and that's the angle I'll take it on,
Yeah.
that they need to know that. And you may not like me, and you may feel that I have broken your trust, I'm saying up front to you, I'm not going to make a decision like that without taking your care into mine. And another thing I'll say to them is, if you tell me not to say something, let's talk about that. And I may respect that.
Good.
But one thing I'm going to say to you is, let's talk about why you don't want them to know.
Yes.
You know, we need to have that conversation. If you're smoking marijuana and you don't want your parents to know, well, you know, it doesn't take a rocket scientist to kind of figure out why. But let's talk about that.
Yeah.
Because their rationale may be that they think their parents are going to, you know, overly discipline them or reject them in some way.
Yes.
And the fact of it is, that may be part of the parent's adolescent experience. It may be something they have a better understanding than the teenager even recognizes.
Yeah.
And I think that the counselor, whatever the role of the counselor is, as youth worker or professional, you know, or just running a Bible study with
Yes.
kids in your church, that you're that bridge a lot of times.
Absolutely.
Between the kid and the parent.
Yes.
You know, there may be bigger problems that the kid has that we don't know about, other than some of the things that he tells us that we think are pretty big problems. There may be bigger problems.
Yeah.
And if you divulge things too quickly or without some kind of discussion with the child, they may just clam up, and bigger problems never get talked about, never get dealt with until it's an absolute crisis and a big mess.
You walk a very fine line between maintaining the child's trust on the one hand and the parent's trust on the other. One of the things that I used to do in my clinical work was, in non-emergency situations, invite the whole family in and throw this whole issue of what is open to discussion and what must be kept in confidence back into the family's lap. I would ask the parents, well, if your child disclosed to me that they were using drugs or having dangerous sexual behavior or engaging in this or that, you know, would you want to know about it? And the kid's usually sitting there with their eyes wide open, and they've never had this kind of discussion with their parents, so they're very intent on hearing what their parents have to say. And oftentimes the kid is surprised that the parents are going to deal with it differently than the child might have expected otherwise. But to have this discussion with the parents and the child present really helped define some clear boundary issues about what can be discussed and what must be kept secret. The kid got a clear idea of what could be talked about, and parents understood that maintaining that kid's trust was very critical for me to maintain. And many parents would say, I'm going to trust you to deal with that, and unless that situation turns ugly or dangerous for my son or daughter, I am willing for you to keep that in confidence with my child. That often gave us permission and just cemented that trust relationship with a child in a way that both met my legal and ethical duties that we clearly have before the state, before the Lord, as well as continuing that counseling relationship that was so critical with an adolescent who looks upon us often as just one more adult
Right.
who's going to impose the parents' rules on them. That's not our purpose or the point.
Yeah. You know, somewhat of a guide rail that I use, and to bottom line some of this is, you know, if there are things that are divulged that are illegal, such as abuse.
Yes.
In our state, we're mandated that it's a misdemeanor if you don't report
Yes.
it. You have 3 days to do so, but it has to be reported.
Yes.
And in fact, it doesn't even have to be, one doesn't even have to tell the parents or the child that you are going to report it. You know, that sometimes I think is wise to do. There's probably other cases where it is wise not to do it, but legally you're not required to let anybody know.
Yes.
And in fact, your reporting is also often anonymous anyways. things of harm, which may also be illegal too, could be drug usage,
Yes.
other kinds of behaviors selling drugs. You've got kids now going back.
Violence threatened
Violence-
against others,
I had-
which more and more young people are doing these days.
I had one young man who had a locker next to the local middle school porn dealer, his locker mate. And, I wasn't counseling him, but if I had have been,
Yeah.
all bets would have been off. I said, that is just absolutely wrong, and we need to deal with this. The other issue is things that won't cause them physical harm. I mean, kids who are having sex and kind of indiscriminately or unsafely. I think that can be something that may need to be told. If the child's not willing to deal with that issue, not willing to take precautions, not willing to, in some case, stop,
Yes.
that may be something that the parents do need to know about.
And increasingly, a lot of kids define sex as having intercourse and don't even consider oral sex and other sexual
Right.
behaviors as having sex or being sexual with someone else. There's a variety of terms that kids have for it, but you may need to get a clear definition of what
Exactly.
sex means from the child you're working with, because it doesn't mean to them what we have understood it to mean for our lifetimes, for example. So having the child define some of their own terminology is very critical in the work you do with them.
I think in the cases where I've worked with situations where a teenager or a young person, something needed to be divulged, the lion's share of those situations, the parents handled very well.
Yes.
I think one of the areas where parents tend to really flip out is around the whole issue of homosexuality. Parents who find their young pubescent boy on the internet looking at homoerotica porn, that tends to freak parents out. I think we can understand why.
Yeah.
And sometimes that isn't handled very well when it gets into some of these less than normal kinds of problems. But that doesn't mean they're going to stay that way. That doesn't mean that reaction isn't going to come down to something reasonable and workable. And I can't think of the situation in the years I've practiced where I've had some parent who's just been so unreasonable about something that they made the therapy or the counseling or whatever the church was trying to do to help a kid, impossible.
Good. Yes.
So I would encourage folks that, sometimes the initial reaction, it may be difficult. But that's part of our role too, is that bridge
Yes.
between the child, the adolescent, and the parent, is to help the parents deal with this stuff.
Yes.
And have a focus that's going to work.
You touched upon abuse situations, which we as professional therapists are mandated to disclose. And of course, I would love to have the church consider itself to be a mandatory reporter. And sometimes, in fact, you are in a church setting. There are some pastors in some states who are designated as mandatory reporters, especially those who are administrators of Christian schools or are directly involved in the supervision of children's ministries, where the state defines anyone in such a role as a professional is a mandatory reporter. It's important to know whether you are a mandatory reporter or not, as you are obligated to report in Virginia within 3 days, in some states within 24 hours, some states 36 hours, other states 2 days. It depends on the state you're in, but within 24 to 72 hours, you are required to make a report to your local Child Protective Services agency, whatever it's called, and that CPS agency may or may not investigate from that point. Many CPS agencies are so overwhelmed with cases that only the most serious kinds of abuse reported get investigated and get acted upon. So it's not even clear whether or not there will be a follow-through by an agency designated with a legal responsibility to protect children. But if you must make a report, do so. What are you to report? Well, if you have a reasonable suspicion, you're not even required to affirm or validate the information you have, but if you have, and it's a reasonable person standard, if you have a good instinct, a reasonable suspicion that abuse has happened, and when a child reports directly that they are being abused physically, sexually, or neglected to the point that their basic welfare is not being taken care of, you've got an obligation to report that to state officials. What is physical abuse? Well, it's non-accidental physical injuries. If you see bruises on a child, and those bruises don't make any sense from the story that you're being told, for most clinicians that creates a suspicion. And in situations of sexual abuse, we often find an adult or even a minor child increasingly involved in being the sexual perpetrator against a younger child. And research indicates that most professional counselors tend to report sexual abuse more than physical abuse or neglect, and that CPS agencies may not consider sexual abuse as critically important sometimes as physical abuse. Again, depending on the caseloads and the demands on the agency, it's difficult to predict sometimes what is going to be investigated.
You know, one of the areas that I think has disturbed me the most over the years in terms of this whole regard, I don't have an option as a licensed clinical social worker in our state to make a decision not to report something if I think it's happening.
Yes.
But I have had numerous situations over the years where a youth pastor, a lay counselor, someone in that position who in our state is not mandated to report.
Yes.
And they have known about sexual abuse, or they've had suspicions, or they've known about physical abuse, and have chosen to not report it only because they legally don't have to.
Yes.
And I think there's a moral responsibility as a Christian, whether we're mandated by laws or not, to report those things. And the reason I say that is because by the time someone finds out, it's been going on for a period of time anyways, in most cases.
Yes.
And if it hasn't, you certainly don't want it to go on longer.
Yes.
But in the cases where that situation has come to me, how much less pain, how much less crisis, how much less sin would have been stopped
Yes.
if a Christian worker had done what I think Jesus Christ would want him to do, is to confront, and a lot of times people don't even confront it with the perpetrator.
Yes.
You know, I've heard this is going on, or I have this concern. Don't even do that. And I think it's an outrage. And it's something that folks, it's scary to do.
It
And
is.
nobody likes doing it.
Yeah.
But it's one of those things that must be done. And the other end of it is, I think people get into this mentality that they have to determine if the sexual abuse is really happening or not.
Yes.
We're not the judge. We're not the investigator, whether it's in the role of the therapist or a layperson reporting it. We're simply reporters.
Yes.
We may be wrong. That'd be kind of nice. I mean,
Yeah.
I'd rather be wrong about it and have to deal with that situation.
Yes.
But to simply stand by and do nothing, I think is morally wrong. I don't see how anyone as a Christian can justify that.
And your situation, Mark, is exactly the reason I would like churches to assume they are mandatory reporters.
Absolutely.
For this kind of situation. Another piece of the pain is that this is one area where churches, and I'm talking about the entire church staff up the supervisory chain, are most frequently sued, is in situations where someone knew about abuse and didn't intervene. Or they intervened thinking they themselves could handle the situation, and the abuse went on with another person or went on secretly and silently, or they accepted the repentance of someone and then relaxed controls after a few weeks or months, and the abuse starts again. When you bring the state in, the state takes responsibilities off your shoulders, off the shoulders of the church, that need to be taken off, and that will stop a pattern often of generational abuse, even that's gone on in families for maybe 100 years. It's critically important to get the state involved. And I know there are some CPS agencies who are not fun to work with, who consider that even corporal punishment is abuse and is wrong. We know that that's wrong. Nonetheless, there is usually one person in every CPS agency that's worth working with. And if you know one person, they know someone else in their agency, request that person, go to them, get them involved. If you are the counselor, make yourself available to CPS, to the family, to the church. Often counselors or youth workers are afraid they're going to lose the trust of the families.
Yeah.
I found that, it's a coin flip. Sometimes you do, but in many situations you don't. Many times a family is incredibly relieved to have this situation finally brought out in the open and addressed in a way that could not be addressed in any other context. So if there's abuse, report it.
And if a family, if a person, if the reporter, whoever that person is, loses the trust that they had in a working relationship with that family, that is probably more to do with that family's manipulation or lack of cooperation to deal with the problem.
Yes.
And my guess is whatever you've learned about is the tip of the iceberg.
Yes.
And be wary that someone who may be hurting their children may also, and again, it happens, we need to understand this, but that's the same kind of person that may hurt your child when they're over visiting that friend. Or that may be the person who is in a leadership role with children for the reasons we stated earlier.
Good. Well done.
It needs to be stated.
Okay. Let's go back to consent issues if we can. I know we got into abuse as it came up very naturally in our conversation, but there's another consent issue that we need to address, and that's around the increasingly common situation of divorce and custodial problems, especially as more and more joint custody rulings are made by the court. Both the father and the mother may have joint custody with primary physical custody of the child residing in one parent, even though the other parent has full legal rights and must be consulted and negotiated with around any major questions affecting the child. That's a very difficult situation when the parents are in significant conflict. And you as a pastor or as a counselor get wrapped up in that conflict. You're caught in a dilemma between the law demanding consent from both parties, but maybe practically only one party can really give it, and sometimes often, I hate to say, one party wants to close out the other from having any influence in those custodial, in those consent decisions affecting counseling issues. Mark, I suppose you deal with this all the time in your practice, huh?
Yeah, it's sometimes when it's a problem, it's a big problem because you're getting caught up in the conflict and the history that two adults have with each other that's getting now played out in the therapy or the counseling arena, and you know, they try to pull the counselor or the lay counselor or the church worker into the mix.
Yes.
And what's important to understand, I think, is that theoretically, parents need to know what's going on with their child, whether they're living at home with them or not. Both parents therapeutically need to be made as much a part of the counseling or whatever work is being done with the kid as can be gotten.
That's a critical term, as can be gotten.
As can be gotten.
Because often we can't get it as clearly as we'd like.
We can't.
This is very murky.
I think that the typical situation you have, unfortunately, is the dad is not the custodial parent. The dad may be the person who is struggling with the time spent with the child, and the child is wanting time with the father. The father may be, dating someone or involved in other things, and it's a very difficult situation. Well, in that case, the dad needs to be invited directly into the process. He needs to be, whichever parent it is, not to pick on dads.
And likely that invitation's not going to come from his ex-wife.
I mean, if it can be, great, but if it can't be, then the therapist, the worker, has to initiate that. And sometimes it's really helpful to have a session, I'm talking about from a counseling point of view, have a session with that non-custodial parent, problem parent, and get their side of things, because generally there is another side.
Yes.
And also they may times feel that they have been left out or don't think that they're as important. And having them involved, being invited into the process, really challenges that and does breed some cooperation. And that way the parent can learn what needs to be learned, live action.
Yes. Good. Mark, thank you very much. I appreciate your input and your participation in this video. And I want to communicate to everyone out there, especially in your work with children, stay covered, okay? Stay connected to your agency, to your church, to your supervisor, to someone who provides you with an umbrella of protection in that work that you do. When you've got someone that you can go and talk to about the issues that you face, when those issues become overwhelming to you, it's critically important for the care of that child and for your protection legally and ethically that you have that person to go to. Don't be a lone ranger. Don't be someone out there doing things on your own without that support and covering of someone who will protect you. I want to thank everyone who has invested their time and energy in this Caring for Kids God's Way program. I trust this series of videos will be helpful to you in your ministry to kids. So on behalf of all the presenters, on behalf of Tim Clinton and the whole AACC team, thank you very much. Good day to you.